Alberta Health Services. Healthy Albertans, healthy communities, together.
Good afternoon, everyone. I'm David Wyant, Chair of the Alberta Health Services Board, and I would like to welcome you to this AHS Public Board meeting. Thank you for taking the time to join us. To start, we, the AHS Board, would like to recognize that our work takes place on historical and contemporary Indigenous lands, including the territories of Treaties 6, 7, and 8, and the homeland of the Métis. We also acknowledge that the many Indigenous communities that have been forged in urban centres across Alberta. Our board members are joining us from across the province and elsewhere in the country, and we acknowledge the Indigenous people's territories in which they live and work. Today we have several motions for consideration from the board's various committees. As well, AHS President and CEO Dr. Verna Yu has some brief remarks about our ongoing pandemic response and the province's upcoming influenza immunization campaign. But first, I'm excited to introduce two new members of the AHS board, Vicki Yellow-Old Woman and Dr. Saye Zelke. Vicki Yellow-Old Woman is an experienced financial professional and member of the Institute of Corporate Directors, who has served in various financial and board roles, including serving as the Corporate Financial Officer for Siksika Health Services. Saye Zelke is an author, business owner, and physician based in Lethbridge, specializing in the treatment of patients with heart disease. She served on the executive of the Alberta Medical Association and holds faculty appointments at the University of Calgary and University of Lethbridge. My brief introductions do not do justice to their full skills and experience. These impressive professionals bring a wealth of experience and expertise in their fields and will be tremendous assets to the board and to all of Alberta Health Services. Vicki and Saye join us at an exciting time as the board, the governing body of AHS, oversees the organization's response to the COVID-19 pandemic, the implementation of changes arising out of the recent performance review, and the continued development of AHS's strategic direction. I'm confident that they will provide valuable perspectives as the board continues this important work for the benefit of all Albertans. Welcome, Vicki and Saye. Now, before I hand the virtual mic over to Verna, I would like to address some administrative matters. We are participating by telephone conference today. When I ask for a vote on a motion, I will ask for those opposed or abstaining. For those who neither oppose nor abstain, I will take it that you are in favor of the motion. If there are none or a minority who neither oppose or abstain, I will declare the motion carried. May I ask that someone move approval of the agenda that has been circulated?
Hugh, I so move.
Thank you, Hugh. Will someone second the motion?
Heidi, I'll second.
Thank you, Heidi. Any further discussion? I believe that Saye and Vicki will abstain as they were not yet on the board at the time of these meetings. Are there any other abstentions or opposed? Hearing none, the motion is carried. Based on that approved agenda, do any board members have a conflict of interest that they would like to declare at this time? Hearing none, we will move on. You have all received the minutes from our meetings of June 24th, July 23rd, August 11th, and September 21st, 2020. Are there any issues, questions, or corrections? May I ask that someone move approval of each of the sets of meetings that have been circulated?
David.
Thank you, David. Will someone second the motion?
Stephen, I will second the motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. Thank you very much. Verna?
Thanks, David, and good afternoon to everyone. It's really good to join all of you here online and wherever you're watching from. I do hope you're having a chance to enjoy what has become, or what has been, a very lovely Alberta autumn. I'd also like to welcome Vicki Yellow-Old Woman and Dr. Saye Zelke to the AHS board, and I look forward to the opportunity to working with both of you. Thanksgiving long weekend is coming up, and I know I'm looking forward to spending some time contemplating what I'm grateful for, even in a year that's been as difficult, challenging, and tragic as 2020 has been. Certainly, I'm thankful to the staff, physicians, and volunteers at Alberta Health Services for the hard work, dedication, and courage they've demonstrated throughout the year, and especially since the first case of COVID was confirmed in the province just over 7 months ago. Our teams, those on the front lines, and those working behind the scenes continue to do everything possible to protect the health and safety of Albertans and each other. And I'm grateful for the many contributions of our philanthropic, business, and academic partners who have helped AHS and Albertans in countless ways, including developing and manufacturing made in Alberta personal protective and medical equipment, funding projects that support mental wellness, and helping us build a field hospital in Calgary that gives us additional acute care capacity if we need it. Meanwhile, medical students at the University of Calgary and University of Alberta joined our contact tracing team over the summer in an effort to limit the spread of the virus. I'm so grateful for all of these contributions to our shared pandemic response. I'm also grateful to the sacrifices Albertans have made to protect one another and ensure our hospitals continue to have enough inpatient and intensive care beds to treat individuals who fall seriously ill from the coronavirus or need a high level of care for other reasons. By late April, our teams across the province have freed up more than 2,200 inpatient beds, including almost 1,000 intensive care spaces in anticipation for a surge of COVID-19 patients. And I'm so thankful that capacity has never come close to being exceeded. Today, with many businesses around the province opening and with many children and youth back in classes for a new school year, we must remain vigilant in our approach to COVID-19 because it is a very present and real threat. Thousands of Albertans have contracted the virus and many lives have been lost. My heart goes out to all the people and families who have lost loved ones or whose lives have been otherwise impacted by this terrible virus. I'm confident that AHS is doing everything we can everything that we are doing to keep Albertans safe. At the beginning of the pandemic in March, we were performing about 35 COVID-19 tests per day. Last week, we performed an average of more than 15,000 tests daily and with capacity to do more. End of last month, we cumulatively tested more than 1 million Albertans with positive cases followed by comprehensive contact tracing because we know for now testing and contact tracing are among our best weapons to fight the spread of COVID-19. Again, I urge Albertans to continue doing their part by following public health guidelines, including maintaining a 2-meter distance, wearing a mask in public places where that distance cannot be maintained, and staying home when sick. As usual at this time of year, I also encourage Albertans to protect themselves and others by getting immunized against influenza this fall. This year, more than ever before, Albertans should get their flu shot. Alberta's immunization program begins Monday, October 19th. When you get immunized, you protect yourself and your loved ones, as well as more vulnerable seniors, young children, and those with chronic health conditions. By keeping the number of influenza cases and outbreaks low, we are also doing our part to help healthcare workers focus on the COVID-19 response. As we learn to live with COVID-19, we're adapting influenza service delivery to reduce the risk of transmission and protect Albertans. This year, AHS will focus the vaccine offered through its public health clinics to children under 5 years of age and their family and household members, individuals who do not have a provincial healthcare number, and people who live in a community where there are no immunizing healthcare providers. If you are eligible to be immunized by AHS, it will be by appointment. We will be offering an online influenza immunization appointment booking tool to be launched this coming Tuesday on October the 13th. All other Albertans are encouraged to call their pharmacist or physician's offices to plan ahead and get in for their immunization. This year, our health system will need to respond to both COVID-19 and influenza. Immunization is the single most effective means of arming yourself and your loved ones against influenza. It also helps people stay healthy and out of hospital, which during time of pandemic is crucial for the health system because we continue to need to open beds for Albertans who need them. Now, although Thanksgiving is still a few days away, allow me to once again thank our amazing healthcare workers and teams across the province for their effort, dedication, and selflessness they exhibit each and every day, often under the most trying of circumstances. They truly are, as many Albertans have called them, healthcare heroes, and I'm proud to call them my colleagues. I'd also like to thank the people of this province for pulling together and doing what's necessary to help each other get through this global health crisis. This has been a difficult time for all of us. We're all feeling COVID-19 fatigue, and yet there are many more months of the pandemic ahead of us. But I know we will get through this as we always do together. And finally, thank you for being here today and for your interest in Alberta Health Services. Back to you, David.
Thank you, Verna, for those important comments. Before I move on to the motions recommended by the board committees, I wanted to go back to something I mentioned earlier, just to make sure the record is correct. I mentioned that Saye and Vicky would abstain from motions because they weren't at the meetings. I meant that to be in respect of the approval of the minutes of the meetings for which they were not in attendance. And so I would ask that our corporate secretary reflect that. So with that, we now move on to the motions recommended by our board committees. I ask Glenda Yates, as chair of the Quality and Safety Committee, to present the first one.
Thank you, David. The Quality and Safety Committee met on September 16th, 2020, and we considered a variety of topics under the general headings of quality, safety, and access to health services. As chair of the committee, I'm presenting one motion for approval of the board today. The committee reviewed the Alberta Health Services Infection Prevention and Control 2019-20 annual report, which is a report that we submit to Alberta Health. And this report provides an overview of the outcomes achieved in partnership with programs across the province, including Connect Care, accountability and monitoring, province-wide surveillance, human resource capacity, physical environment and infrastructure, public awareness and education, and hand hygiene. The committee recommends that the board approve the IPC annual report. The board also reviewed the report, and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the Alberta Health Services Infection Prevention and Control 2019-2020 annual report to Alberta Health and direct the board chair to submit the same to the Minister of Health. I so move.
Thank you, Glenda. Will someone second that motion?
Brian Vasjo, and I'll second that motion.
Thank you, Brian. Is there any further discussion? Is anyone opposed or abstaining? The motion is carried. I'll ask David Carpenter, as chair of the Finance Committee, to present the next set of motions.
Thank you, Mr. Chair. The Finance Committee met on September 17, 2020. And as chair of the Finance Committee, I'm presenting three motions for approval today. First quarter 2021 investment report was considered by the committee. As mandated by Alberta Health Services Investment Bylaw, the committee is required to review reports prepared by management and investment managers summarizing the activities and performance of Alberta Health Services investment portfolio on a quarterly basis. The committee was presented the first quarter 2020-2021 investment report and recommended that the board ratify the transactions. The board reviewed the recommendation and the members support the approval. Accordingly, I move that the Alberta Health Services Board ratify the investment portfolio and transactions as described below and as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager North Investment Management. A, as at June 30th, 2020, AHS held restricted and unrestricted funds managed by Phillips Hager North Investment Management and Manulife Financial totaling $851 million. B, the funds were invested in short-term treasury bills, federal, provincial, municipal, and corporate fixed income bonds, pooled mortgage funds, bond funds, real estate funds, Canadian and global equity funds. And C, all of the funds invested during the quarter ended June 30th, 2020 were invested in accordance with the investment bylaw and investments policy as certified by signed investment compliance certificates from Alberta Health Services and Phillips Hager North Investment Management. I so move.
Thank you, David. Will someone second the motion?
I'll second. This is Heidi.
Thanks, Heidi. Is there any further discussion? Any opposed or abstentions? The motion is carried. David, your second motion. please.
The second item considered was the consolidation of all current agreements with Astor Joint Venture Limited Partnership under one master services agreement, along with an amendment to renew the long-term care services at Aged Care Seaton in Calgary for an additional 5 years commencing November 30th, 2020. The committee recommended board approval. The board reviewed the proposed amendments and the members support the approval. Accordingly, I move that the Alberta Health Services Board approve the following on the terms reviewed by the Finance Committee and the Board, with such non-substantive changes that management of Alberta Health Services considers necessary or advisable. 1. The consolidation of the current agreements with Astor Joint Venture Limited Partnership relating to Sagewood Seniors Community Inc., Seaton Senior Community Inc., Walden Heights Senior Community Inc., Skypoint Seniors Community Inc., and Sunrise Gardens General Partnership under one new Master Services Agreement with Astor Joint Venture Limited Partnership. 2. The amendment to renew the long-term services at Aged Care Seaton in Calgary for an additional 5 years, commencing November 30th, 2020. And 3, the delegation of authority to the President and Chief Executive Officer to execute the above agreement and amendment on behalf of Alberta Health Services in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
It's Glenda here. I'll second that.
Thank you, Glenda. Is there any further discussion? Any opposed or abstentions? The motion is carried. Back to you, David.
Lastly, Mr. Chair, the committee reviewed a proposed 17-month contract extension to the service agreement between Alberta Health Services and Associated Ambulance and Services Limited with respect to ground ambulance support, which currently expires March 31, 2021. The committee recommended board approval of the extension. The board reviewed the extension and the members support the approval. Accordingly, I move that the Alberta Health Services Board A approve the extension to the service agreement between Alberta Health Services and Associated Ambulance and Services Limited for the term from April 1, 2021 to August 31, 2022, and B, delegate authority for the President and Chief Executive Officer to execute this extension in accordance with Policy 1100, delegation of authority and establishment of controls for commitments. I so move.
Thank you, David. Will someone second the motion?
This is Stephen. I'll second the motion.
Thank you, Stephen. Any further discussion? Any opposed or abstentions? The motion is carried. I will ask Dr. Brenda Hemmelgarn, as chair of the Community Engagement Committee, to present a motion.
Thank you, David. The Community Engagement Committee met on September 18th, 2020. One item the committee considered for board approval is being presented today. The board members of the Mental Health Foundation voted to amend a provision of their bylaws to expand the scope of the foundation from Edmonton to communities throughout Alberta. The Mental Health Foundation is an established foundation, and any amendment to its bylaws is required to be approved by the AHS board and then submitted to the Minister of Health for approval. The amendment will be effective upon ministerial approval. The committee reviewed the proposed amendment to the expanded definition of communities as well as minor non-substantive amendments. The committee recommended that the board approve the bylaw amendments. The board also reviewed the amendments and the members support the approval. Accordingly, I move that the Alberta Health Services Board 1. Approve the proposed amendment to the Mental Health Foundation bylaws to redefine the term communities to be communities throughout Alberta, as well as minor non-substantive amendments as reviewed by the committee and the board. And 2. To direct the board chair to sign the amended bylaws on behalf of AHS and management to forward the same to the Minister of Health for approval. I so move.
Thank you, Brenda. Will someone second the motion?
David, I'll second.
Thank you, David. Is there any further discussion? Any opposed or abstentions? The motion is carried. We've reached the end of our agenda, but before we end the meeting, I would like to acknowledge that, completely unrelated to her role on our board, Dr. Hemmelgarn is the Dean of the University of Alberta's Faculty of Medicine and Dentistry, the home of Dr. Michael Houghton, who was just named as the recipient of the Nobel Prize, in part for his role in the discovery of hepatitis C. We extend our congratulations to Dr. Houghton. We are very proud of him, as we are of the unsung researchers and staff at each of the educational and clinical institutions. Having reached the end of our agenda, I declare the meeting adjourned. Thank you for joining us. Stay healthy, schedule your flu shot, and be kind to one another.
Together, we do amazing things every day.